Welcome back to the Elderly Health Physician, the channel where we bring you the wisdom of Korean medicine combined with the best of modern science to help you thrive after 60. I am John, and today we are talking about something that affects tens of millions of people over 60 and is almost always dismissed as an unavoidable part of getting older. We are talking about dry, blurry vision. That foggy, frosted feeling when you first open your eyes in the morning. That gritty, burning sensation that builds through the afternoon. The frustration of trying to read a menu, a label, or a message on your phone, blinking several times and still not being able to bring the words into focus. And the most dangerous thing about all of this is not the discomfort itself. It is the fact that most people simply accept it. They reach for artificial tears, they squint harder, they buy stronger reading glasses. They tell themselves this is just what 60 looks like. But today's guest says that assumption is not only wrong, it is costing people years of clear, comfortable vision that they could be enjoying right now. Joining me today is Korea's oldest practicing physician, Dr. Henry Lee. He has spent over 40 years treating seniors and studying the ancient principles of Korean medicine that have kept generations living strong and seeing clearly well into their 80s and 90s. Today, doctor, you have 5 tricks that you say can relieve dry and blurry vision almost instantly. I know our viewers have been waiting for this. Welcome back.
Thank you, John. Before I give you the 5 tricks, I need to explain what is actually happening in the eye after 60, because once you understand the mechanism, the solution becomes obvious. 2 things break down. First, the meibomian glands, tiny oil glands embedded in the eyelids, stop secreting the lipid layer that keeps the tear film stable. Without that oil, tears evaporate in seconds and the eye dries out. Second, the ciliary muscle, which controls the lens for near and far focus, stiffens and slows. Vision blurs at certain distances. The good news is both systems respond to the right stimulation. That is exactly what these 5 tricks address. A study published in the journal Cornea followed over 900 adults over the age of 60 and found that more than 65% had measurable dysfunction in their meibomian glands. Not cataracts. Not macular degeneration, simply blocked oil glands in the eyelids producing a tear film too thin and too fragile to maintain clear vision. The moment those glands were restored, clarity returned in the majority of cases. So let us begin. Trick number 1, the Korean palming method. This is not something I invented. It comes from traditional Korean healing practice and has been used for centuries to restore vitality to the eyes. And it is almost embarrassingly simple, which is why so many people underestimate it. Here is exactly what you do. Sit comfortably, either in a chair or on the edge of your bed. Close your eyes. Now rub your palms together firmly for about 20 to 30 seconds until you feel significant warmth building in your hands. Then cup your palms gently over your closed eyes, the hollow of the palm resting over the eye socket, without pressing on the eyeball itself. Hold this position for 2 full minutes. Breathe slowly and deeply throughout. What is happening during those 2 minutes? The warmth radiating from your palms does several things simultaneously. It increases blood circulation to the small capillaries around the eye, behind the retina, and through the optic nerve. It softens the meibomian gland secretions, which with age become thicker and more waxy, similar to cold butter that becomes too stiff to spread but flows freely when warm. And it deeply relaxes the ciliary muscle, which in most seniors over 60 is in a state of near constant tension from hours of fixed focus reading, screens, and close visual work. When that muscle releases, focus clears. When the gland oils soften, the tear film stabilizes. When circulation improves, the retina receives the oxygen and nutrients it needs to function sharply. I had a patient once. She was 68 years old, a retired school teacher from Busan. Every morning she woke up to vision like looking through frosted glass. She had used artificial tears for over a year with little improvement. I taught her the Korean palming method. Within 4 days, she called my office to say that for the first time in 18 months, her vision had been clear from the moment she opened her eyes. 2 minutes, that is all it took. Trick number 2. The intentional blink. Reset. Most people over 60 have no idea that they have almost stopped blinking. A clinical study published in the journal Optometry and Vision Science found that the average blink rate in adults over 60 drops to between 5 and 7 blinks per minute. In younger adults, the normal rate is closer to 15 blinks per minute. This difference is enormous and its consequences are serious. Every single blink does two critical things. It spreads a fresh layer of tear film across the entire surface of the eye, and it physically compresses the meibomian glands, pumping the stored oil into the tear film and keeping it stable. When you blink less, you are not just spreading the tear film less frequently. You are starving the glands. The oil builds up inside without being expressed. The film breaks. The eye dries. Vision blurs. Equally important is the quality of each individual blink. Many seniors blink incompletely, the upper and lower lids coming close but not fully meeting. An incomplete blink does not compress the glands. It does not fully distribute the tear film. It does nothing. It is a phantom blink that provides none of the protective benefit of a true, complete closure. The intentional blink reset corrects both problems. Stop what you are doing. Close your eyes slowly and deliberately. While they are closed, gently but firmly squeeze the eyelids together for 2 full seconds. Then open slowly. Repeat this 10 times in a row. Do the sequence 3 to 5 times a day, and especially after reading, watching television, or using any screen. When you perform a complete, deliberate blink, you are physically compressing the meibomian glands. You are expressing the stored oil. You are refreshing the tear film. The clarity this provides can be felt within minutes. I had a patient, a 72-year-old retired engineer from Seoul. He had been diagnosed with chronic dry eye syndrome and was using prescription anti-inflammatory eye drops twice daily. When I asked him to estimate how often he blinked while watching television, he had no idea. So I had him use a simple counter during a 1-hour program. He completed fewer than 50 blinks in 60 minutes. Less than 1 per minute. His tear film was collapsing within seconds of each blink and had almost no recovery time before the next stimulus arrived. I asked him to do the intentional blink reset every 30 minutes throughout the day and to consciously blink fully every time he was aware of looking at a screen. Within 2 weeks, he had reduced his eye drop usage by half. Within 6 weeks, he had stopped altogether. The glands were not broken. They had simply been left dormant for years.
You know, doctor, conversations like this one make me think about something I came across a while back. It is called the Senior Body Reset After 60. I have to be honest, when I first found it, I was not expecting much, but it completely changed how I think about aging. It covers exactly what we talk about on this show: how to reset your body's natural rhythms after 60. Better sleep, stronger circulation, sharper memory, more energy throughout the day. And it does all of that through daily habits, not medications. No complicated routines. Just clear, practical steps backed by the same kind of medical thinking we explore in every episode. If you are someone who wants to take what you hear here and actually put it into action, this is a resource worth looking into. The link is in the description and in the pinned comment below. Now, doctor, please continue.
You are right, John. And trick number 3 is perhaps the most immediately satisfying of all 5, because the results can be felt in as little as 5 to 8 minutes. Trick number 3, the warm compress protocol. This addresses meibomian gland dysfunction directly by using sustained heat to restore the flow of oils that should have been coating your tear film all along. Here is how to do it. Take a clean washcloth, run it under warm water, not hot enough to cause discomfort, but warm in the way that a heated towel feels welcome in the morning. Wring it out so it is damp but not dripping. Close your eyes and lay the warm cloth over both eyelids. Hold it there for 8 to 10 minutes. If it cools before the time is up, briefly re-warm it and reapply. What is happening inside the lid during those 10 minutes? The meibomian glands are lined with sebaceous tissue that produces a complex mixture of lipids called meibum. After 60, this meibum changes in composition. It becomes thicker, more viscous, sometimes approaching a waxy consistency. It no longer flows freely through the gland openings, it clogs. The oil that should be coating your tear film and protecting it from evaporation is sitting trapped behind a plug of solidified gland secretion. Heat liquefies it. It is that mechanical and that direct. Research from Korean ophthalmologist at Hanyang University Hospital in Seoul, published in the Journal of Clinical Medicine, examined the immediate effects of warm compress application on tear film stability and meibomian gland secretion in patients with gland dysfunction. The measurements taken immediately after a single warm compress treatment showed significant increases in the tear film lipid layer thickness, meaning more oil had been released into the film, and a measurable improvement in tear stability. This was after a single session. With daily application over weeks, the cumulative benefit is substantially greater. I had a patient, a 75-year-old retired accountant. He came to my clinic with vision that he described as going in and out throughout the day. Clear one moment, blurry the next. Clearing again after a hard blink, then blurring once more. This is the classic pattern of meibomian gland dysfunction. The oil is present inside the gland but cannot get through the opening. A hard blink forces a small amount through, clears the vision briefly, and then the film breaks again as the oil supply runs dry. After 3 weeks of the warm compress protocol every morning, his symptoms had dropped by more than half. After 6 weeks, they were almost gone. He told me it was the first time in 3 years that he could read the newspaper from start to finish without his eyes giving out on him halfway through. 8 minutes every morning. That is all it took. Trick number 4 is the one that tends to surprise patients the most because at first, it does not sound like it is about the eye at all. It is about a muscle. But it is the most important muscle most people have never thought to exercise. Trick number 4, the near and far focus shift. After the age of 60, the ciliary muscle, the small ring of smooth muscle inside the eye that controls the shape of the lens when shifting focus between distances, begins to lose elasticity. The medical term for this is presbyopia. By age 65, the condition is present in nearly all adults to some degree. The lens stiffens. Focus switching, which was once instantaneous in youth, becomes slow and incomplete. This is why many seniors describe a specific kind of blurry vision that is not constant but situational. Fine while looking at the wall, blurry when they look down at a book, or clear up close, unclear in the middle distance. The ciliary muscle is failing to complete its adjustment in time. Now here's the critical insight that most people miss. The ciliary muscle is a muscle, and like every other muscle in the body, it responds to use and deteriorates from disuse. Most seniors today spend the majority of their waking hours looking at a fixed distance. A television across the room, a phone held at arm's length, a book resting in the lap. The eye never shifts. The ciliary muscle is asked to hold one position for hours at a time. Over months and years, it loses the ability to shift quickly, and when you need it to shift, it cannot. A study published in JAMA Ophthalmology followed adults between the ages of 60 and 75 who performed a structured focus, shifting exercise daily for 12 weeks. Compared to a control group who did not, the exercise group showed measurably better near vision acuity and reported significantly reduced symptoms of eye strain and intermittent blurry vision at both near and far distances. The benefit was especially pronounced in individuals who spent more than 4 hours per day looking at screens or reading. Here's how to do the near and far focus shift. Sit comfortably near a window or in a room where you have a clear view of something at least 20 feet away. Hold your thumb up at arm's length, directly in front of your face. Focus on your thumbnail, hold that focus for 10 full seconds, letting the image become as sharp as possible. Then shift your gaze to the distant object across the room or outside the window. Hold that focus for 10 seconds. Return to the thumb. Alternate 5 times per session. Do this 3 times a day, once in the morning, once in the afternoon, once in the evening. I had a patient once. 69 years old, a retired civil servant who had worked most of her career in administration, reading documents all day. She had developed what she described as a permanent fog over her close vision. She could not read a page of text for more than 10 minutes before the words became unreadable. She had seen 2 optometrists. Both had updated her prescription. Neither had helped. When I assessed her, the problem was not the prescription. Her ciliary muscle had essentially locked in one position from decades of holding the same close reading distance. I prescribed no drops and no supplements. Only the near and far focus shift 3 times daily. In 6 weeks, she returned to my clinic and told me she had just finished an entire novel, reading for up to 2 hours without losing focus. The muscle had been unlocked simply by being asked to move again. Your eyes are not designed to hold a single focal distance for hours on end. They are designed to scan, shift, and track across constantly changing distances. The natural human environment has always required the eye to adjust constantly. Close objects, distant objects, bright open sky, dark shadow. Modern life has removed all of that variability. We have given the ciliary muscle one job and one distance, and then we wonder why it stops cooperating. The near and far focus shift restores what the eye was always meant to do. Trick number 5, the Korean Eye Nutrition Protocol. This is the trick with the longest timeline for full results, but it is also the one with the most profound long-term impact, because it addresses a dimension of vision loss that almost no one talks about, and that is the nutritional environment of the eye. In Korean medicine, there is a principle that I translate roughly as this. What the body shows on the surface, the blood has failed to supply from within. Dry eyes are not only a surface problem, they are a nutritional problem. And once you understand this, the solution becomes not about what you put in your eyes, but about what you put in your body. The tear film that protects and nourishes the surface of your eye is not just water. It has 3 distinct layers. The innermost layer is a mucin coating produced by goblet cells in the conjunctiva. The middle layer is aqueous, mostly water produced by the lacrimal glands. The outermost layer is lipid, the meibomian oil. Each of these layers requires specific nutritional raw materials to be synthesized properly. When the body is deficient in those materials, each layer fails in a different way. And no amount of artificial tears applied from the outside can replace what the body is failing to produce from the inside. The first and most critical nutrient for the aging eye is omega-3 fatty acids. Omega-3s are the primary raw material for meibomian gland oil production. Without adequate omega-3s in the diet, the glands produce a thicker, more inflammatory lipid that clogs the gland openings rather than flowing freely into the tear film. A review published in the journal Nutrients examined multiple controlled studies on omega-3 intake and dry eye disease in adults over 60. Adults with adequate daily omega-3 through food sources consistently showed better meibomian gland function, more stable tear films, and fewer symptoms of dryness and blurry vision than those who were deficient. In Korean cuisine, the richest sources are mackerel, sardines, and anchovy. These small, oily fish have been a daily staple of the Korean diet for many centuries. This is not cultural coincidence. It is nutritional wisdom accumulated across generations of watching what keeps the body functioning well into old age. The second nutrient is lutein. Lutein is a carotenoid pigment that concentrates specifically in the macula, the small central region of the retina responsible for sharp, detailed central vision. After 60, macular lutein density begins to decline. As it falls, contrast sensitivity drops. Edges appear less defined, faces become slightly harder to read, colors seem slightly washed out. You can replenish lutein through eggs, spinach, kale, and the seasoned greens that appear on the table at almost every traditional Korean meal. Not by coincidence. The third nutrient is vitamin A. Vitamin A is essential for the goblet cells in the conjunctiva that produce the mucin layer of the tear film. Without sufficient vitamin A, the goblet cell population declines. The mucin layer thins. The tear film loses its ability to adhere evenly to the surface of the eye. The result is dryness and a blurry vision that cannot be corrected from the outside because the deficiency is internal. The best food sources are carrots, sweet potatoes, and nori seaweed, all of which are central to traditional Korean cooking, and all of which appear at my own table every week. I had a patient, 77 years old, a retired midwife who had raised 8 children and worked in her community for over 50 years. She came to me with severe dry eye that 2 previous physicians had told her was irreversible. She had been using lubricating drops 4 times daily for 2 years with very little relief. I ran a nutritional assessment. She was consuming almost no omega-3. Her diet had almost no leafy greens. Her vitamin A was in the lower range of acceptable. She had, without realizing it, been slowly starving the three systems responsible for producing a healthy tear film. I put her on a simple Korean food protocol: sardines 3 times a week, a daily portion of seasoned spinach, carrots and sweet potato at least 4 days a week, nori or seaweed soup twice a week. No supplements, only food. In 10 weeks, her dry eye severity score had dropped from severe to mild. In 14 weeks, she had reduced her eye drop usage from 4 times a day to once. She wrote me a letter after 4 months. She said, "Doctor, my eyes did not get better. My life did." And I believe she was right. The body has not forgotten how to function. It has simply been deprived of what it needs. Now, I want to say something important about all 5 of these tricks together before we close. They are not alternative treatments that bypass medical care. If you have a diagnosed eye condition, a cataract, glaucoma, macular degeneration, please continue working with your eye care professional. But the 5 things I have shared today address the most common and most overlooked reasons why vision becomes dry and blurry after 60. Not because the eye is broken, but because 3 specific systems, the meibomian glands, the ciliary muscle, and the nutritional supply, have been neglected. Address them, and the eye responds. Sometimes gradually, sometimes within hours, the body remembers what clear vision feels like. We simply have to stop preventing it from getting there. Begin with 1 trick. Practice it daily for 1 week, then add the next. The palming method every morning for circulation and gland health. The intentional blink reset throughout the day for tear film restoration. The warm compress every morning for meibomian gland function. The near and far focus shift 3 times daily for ciliary muscle maintenance. And the Korean eye nutrition protocol for the internal foundation that all of the other systems depend on. You do not need to do all 5 at once. You need to start somewhere. And that somewhere is today.
That is such a powerful note to close on. The body remembers. And I think what strikes me most about everything Dr. Henry Lee has shared today is how connected these 5 tricks are to each other. It is not 5 separate solutions. It is one integrated approach to restoring what the eye needs to do its job. Circulation, hydration, nutrition, movement, and the discipline of small daily habits that cost nothing and require nothing but your attention. So, to bring it all together for everyone watching. Trick 1. The Korean palming method. 2 minutes every morning and evening to warm the glands and restore circulation. Trick 2. The intentional blink reset. 10 deliberate blinks 3 to 5 times a day to express the meibomian glands and refresh the tear film. Trick 3. The warm compress protocol. A warm, damp cloth on closed eyelids for 8 to 10 minutes every morning to unblock the gland openings. Trick 4. The near and far focus shift. 5 alternating focus rounds 3 times a day to keep the ciliary muscle flexible and responsive. And Trick 5. The Korean eye nutrition protocol. Daily omega-3 through oily fish, lutein through leafy greens and eggs, and vitamin A through carrots and sweet potato, so that the body has the raw materials to produce healthy tears from the inside. Korea's oldest physician, Dr. Henry Lee. Thank you as always for reminding us what the body is still capable of when we give it what it needs. And thank you to everyone watching. If you found value in today's episode, please subscribe so you never miss what we bring to you here. The link to the Senior Body Reset After 60 is in the description and in the pinned comment below. We will see you in the next one.